Hello, my name is Annalie Braddock, and welcome to Medical Nutrition Therapy for Stroke. So, a stroke is the third leading cause of disability worldwide, and it is the second leading cause of death in the US. Millions of people die around the world every year. It happens when blood flow in the brain is blocked. Oxygen cannot be delivered to these neurons, which causes them to not be able to function properly. When this happens, they can't send messages to the muscle cells in other parts of the body, which control our movements. So those muscles, because they can't move, begin to atrophy and resulting in disability and inability to perform ADLs, which are activities of daily living, gait issues, and just overall hindered independence in these individuals. And that can be really devastating for them. So risk factors are age, if you are over the age of 50, have a family history of cardiovascular disease, a previously existing blood clot, high levels of stress, use tobacco and alcohol, other risk factors such as high blood pressure, cholesterol and blood sugar, and an overall poor diet. Usually a combination of treatments is required to treat a stroke. It usually involves physical therapy, occupational therapy, speech therapy, as well as many other types of cognitive and behavioral therapies. And the earlier that you can get a patient into a rehab program, the better the outcome will be for them. Nutrition therapy is also another type of therapy that can be used for these patients. And there are certain foods that you should and shouldn't avoid. Foods that you should eat are whole grain, citrus fruits, green leafy vegetables, among many other things. They are high in antioxidants and phytochemicals and fiber and vitamins and minerals, which all play a really important role in tissue repair, which can help with the effects of muscle atrophy. Foods to avoid would be red and processed meats, refined grains, high-fat dairy, and sweets, because these foods are high in animal fat, sodium, and have a high glycemic index, which can put your cardiovascular system under a lot of stress and increase your risk for stroke. Studies have shown that up to 73% of patients can be malnourished. And one study in particular found that the number of malnourished patients continued to rise throughout the physical therapy rehabilitation program. On the other hand, research has shown that nutrition therapy cannot significantly improve physical performance or mental health. But however, it does have a significant effect for being able to treat the problem of malnourishment in these patients. Therefore, the best recommendation that I can make for you and the best takeaway message that you take away from this presentation is that medical nutrition therapy should be used as a component in the rehabilitation plan, along with physical therapy, speech therapy, OT, behavioral therapies. It should be one of many components in the rehabilitation plan that is individualized for that patient's needs, because each type of therapy is able to treat a different problem that is associated with the results of having a stroke. There are different types of nutritional therapy. Nutritional therapy can actually be very simple and easy to add into the rehab program. It can occur as nutritional lectures, counseling, supplementation, parental or enteral nutrition, which may be important for patients who suffer from aphasia, which is when they lose their ability to swallow and speak, as well as general dietary recommendations or restrictions. Thank you.